All right. Hello, my girl Sparrow. How's it going?
Hi, Kylie. I'm doing great. So nice to be here with you.
Likewise. Well, I want to start out by thanking you because I know so much of what drives you is really rooted in your personal experiences, becoming a mother, your work as a birth worker and massage therapist, and your magic really extends beyond Los Angeles. But what you've built at Sparrow's Nest is so remarkable. It is such an integral part of our community, and my clients are just obsessed with it. Everything from the vibe to the team and to the intentionally curated services. So I just want to thank you so much for your contribution. It's so wonderful.
Oh, thank you so much. You know, hearing the impact that the space and the work itself has on the community and, the babies that come as a result, like really just means the world to me. So thank you for those kind words and for trusting me with your clients.
Of course. Thank you so much. So let's get into it. Let's talk a bit about massage. So, of course, it feels nice. It relieves some tension. You get an hour, maybe more on your own. So, can you walk us through why people should be getting massage prenatally, postpartum, and how it helps support a physiological birth?
Definitely. And I'm gonna try
I know that's
try
a
to keep it
lot.
concise, but like let me just say, for example, most places that will do prenatal massage, there's just not a lot of in-depth training. And so there's a lot of hesitancy in many of the practitioners. And so what ends up happening is that you get pretty much a very relaxing oil application, which does have therapeutic benefits, don't get me wrong, but there are a lot of untouched areas that are really important. So, for example, like if you are coming into pregnancy with like pre-existing structural issues, it's really nice to get those taken off. Ideally in first trimester before you're gaining extra baby weight and extra fluid and more hormones are making things less stable. But most places won't touch you until you're 14 weeks or more. And that's not really evidence-based at all. That's a really an unfounded liability concern. So there's so much that can happen. And when you work with a team like my team, where this is our focus and this is our specialty, we're really able to filter through what is evidence-based. Let's weigh out the costs and the benefits, like for first trimester, for example, this is a time where so many people's pregnancies are a secret, and the evidence says that stress, which we know is one of the, top reasons that can cause all kinds of adverse effects in a pregnancy, stress actually decreases over the course of a pregnancy. And so these first trimester moms are being told, sorry, we can't see you during the time that they might most critically need it, when it might be the most stressful, when the world is not acknowledging what they're going through. They're still wrapping their heads around what they're going through, what kind of financial changes, what kind of, job changes, relationship changes. And so I really wanted, Sparrow's Nest to be a place where, like, no, you belong here. You can come here and we can start working on these issues in early pregnancy so that as your body changes week to week, we're not chasing the pain.
Right.
We're not chasing the structural issues that were, part of your life before you ever even got pregnant. Like we can get you to a place where you're really have the bandwidth and the space to take on all that pregnancy brings, both physically and emotionally.
Absolutely. That's a beautiful offering. And like you said, it's not really offered at a lot of places because of that, or you said the maybe preconceived liability of what that looks like. But it is so important, especially to have that support in the very beginning, where, like you said, a lot of people aren't even aware. So you're kind of in a little bit of a silo. So,
Absolutely. Yeah. And then, as pregnancy progresses and when we're getting close to like the birthing window, then of course we really want to maximize space, maximize softness in the soft tissues. And, it's like if your tissues aren't yielding or you haven't practiced, like what does that even feel like, And I feel like massage creates such a wonderful space to have somebody who, we're spending a lot of time together, right? Like we're spending at least 60 minutes hands-on with you. We can help you coordinate your breath with what we're feeling, give you feedback in your tissues, help women really get a deeper kinesthetic awareness of like, where is my body in space and time? What am I feeling here? And give voice to that and create a real kind of practiced brain-body connection that can build over the course of a pregnancy as we, have these sessions together. And then, of course, everything that we're doing during pregnancy will definitely, play into a smoother postpartum recovery. And then in postpartum, I feel like moms need a lot of support. I mean, this, like we just do a terrible job as a culture, I think in general of fully showing up, for women in the postpartum period. And, a lot of what we're dealing with kind of our, repetitive use injury type issues because you're doing the same positions, in the middle of the night when you're exhausted, you don't know what day it is, you don't know what time it is, and yeah, and you're not in the space necessarily to be like, okay, let me correct my posture and make sure I'm doing this in like the best alignment. And so it can be um to add pain on top of the already innately hugely transformative time of postpartum. I think that if we can hold space for both of those things in a session, um, that it does the mother like so much good. And then we know that it's a mother baby dyad, right? If we can take care of mom, baby by default is going to do better.
Absolutely. I love that too, and what you were saying about kind of that mind body connection, because it sounds like the work you do with mothers throughout, their pregnancy helps in postpartum, but also throughout labor. So that thing with
Mhm.
connecting body to breath, that's obviously the most important thing throughout labor. So is
Yeah.
that how you would say, like, what are some other benefits from massage? So I imagine that's like one of the biggest ones, right? Is like, how can you kind of create that container within your body? You're getting some work done. Sometimes that might be uncomfortable. Sometimes it's, full of pleasure. But is other than that type of connection, what are some other things that are happening that might prepare someone for labor?
It's a great question. I mean, some of it can really depend on what a specific client is wanting in a session. And we're really committed to creating super tailored sessions and meeting our clients, where they want to go. So, that can range from anything from as simple as like we're going to do, you know, work on your scalenes, work on like the connections of your pec major. We're going to do intercostal work and really help you work on like lateral breath expansion, posterior breath expansion. I'm going to place my hands on the sides of your rib cage. Can you play with how much you can push my hands away with your breath, Okay, I'm going to do some work here for a little while. You just relax and we'll come back to that. And then all of a sudden you can see just in the course of a few minutes, like, wow, the breath expansion like really changed here. So we can really, for me, I'm interested in again, meeting clients where they want to go, but if they want to go to the place where can we actually change the landscape of your body? Like, can we do deeply respectful but very efficient work to actually, let's work with the fascia. Let's see if we can create space between the rib cage and the pelvis. Like an oil application is just not going to do those things. And when we can change what's going on in the breath, when we can change like the amount of freedom that the diaphragm has, when we can give the rib cage, some more options other than just the typical, front flare pattern, what is that doing for baby? How much real estate are we able to open up for baby? So that's one end of the spectrum. And then, we can and sometimes do work um through the sheet. We don't do any internal work, but we can work on uh the deep lateral rotators. We can work on pelvic floor attachments just at the ischial tuberosities, which is our sits bones for anybody who's not familiar with that term. And then we can, have a client be like, even touching the sits bones. And again, this is all done like through a sheet and just saying like, these are these are two places where baby's head is going to be passing through. Can you feel this in your body? Can you breathe into this area? And sometimes clients haven't even really thought about like, whoa, it's like you think, okay, yes, the baby's going to pass through my yoni, baby's going to pass through my vagina, but what bony structures are they actually having to traverse? And where are they? And what does that feel like in my body? And, again, we have our scope of practice. Like I definitely think that like pelvic floor physical therapists can do this, to a much deeper degree than we can. And, there's a certain edge that we won't cross. But sometimes we really are that bridge, where we can have clients come in and we're building relationships with them. And we might be the introduction to that work for them.
Absolutely. That's even the anatomical structures, because on one hand, birth is super easy and most of the time pretty straightforward. But again, like these are all just tools in the toolbox. And the more you're consciously connected to them, you can understand where you are. It kind of puts like time and spaces to like, this is what's happening and why. And when you get a better understanding, and what you said about even creating that space for breath. Like even that, I never even thought about with something like massage of that being a benefit. That's huge.
Absolutely.
And you think of maybe just like relieving tension and things of that nature. So then that leads me to believe that this can be really beneficial when it comes to if a baby's in breech position, massage can maybe help create more space. Is that the case as well?
Absolutely, yeah. And I mean, I have personally had breech babies turn on the table during a massage, which is super rare, but it has happened. I have
Wow.
had clients who were at like 38 weeks where they were like, there's like a 2% chance or something like that of your baby turning. And we're not going in saying like we're going to turn your baby, right? Because that's not our job. And sometimes babies are super intelligent and they're in that position because it's the best position for them. But what we can do is just create the open real estate for them to have all of the options available to them, so we can create a lot of space and a lot of balance in the pelvis. Like I said, in the rib cage, I think is really important for breech. I think that sometimes that gets a little bit left out of the equation when we're focusing just on the pelvis itself. Both I think are really important. And yeah, we can definitely help with having breech babies turn, or at least having the space if they choose to turn, and really just for any baby to have all of the optimal real estate available to them for them to find their own perfect, position for birth.
They deserve that. And I know we live in a society, and we're in California where it's a little tighter with that of like, we're quick to induce, we're quick to, oh my God, the baby's breech. If you are, enlisting the help of a provider and not free birthing or something, you're on a kind of like the baby has to flip and then your options get very limited. So then we're
Yeah.
putting stress on the mom and the baby of like, oh my God, if the baby doesn't flip by this amount of time, and so sometimes we get in that place too where it's like what can be done and you're trying all the different things. But I mean, this sounds like a really lovely way to try to, encourage a baby to get an optimal position for birthing in a, more traditional setting in that regard. So, I mean, that is a good.
Yeah. Yeah, and I'm glad you brought up, induction as well, because I think, I've been a birth worker since 2011, a massage therapist since 2007, and it's strange that like to me that's not that much time, but I have seen tremendous changes in the birth climate. Like even when I started, I could as a young like junior apprentice like potentially attend breech births at home or twin births at home with licensed midwives, and that was taken away. And yeah, just the climate has continued to create more and more constraints and more pathologies in birth. And yeah, in a perfect world, like I wouldn't even need to offer induction massage,
I was
you
going to
know?
ask that because I know one of your offerings is the labor induction massage. So I would love to learn more about that. I had a client come in recently and I'm just curious because again, we're like the midwife's brew and all the different things that you can do, which I'm still a believer it's on baby's time. But again, given the constraints that, if you're 41 weeks, 6 days at 11:59, a midwife has to turn over care. Or
Right.
the
The
induction.
only person that's been with you your entire journey is just going, yeah,
And then you
it's
get turned over to a whole new system that you weren't trying to get involved with. So again, as much as I am always encouraging that the baby knows, the baby has dominion over time, I understand that sometimes we're in these situations. So how can we gently do that? So could you talk a little bit about how the labor induction massage works? Like what's happening to encourage induct the labor rather?
absolutely, yeah. And yeah, I agree. Like I had to really sit with and think of, you know, okay, I would rather, babies come on their own time, but here's the reality, and is this offering going to do more good? And I do believe that the answer is yes. So to be fully, totally transparent with you, we do, these intense like acupressure points during this massage. But another huge focus of the massage is just nervous system sedation, autonomic nervous system sedation. And I can't quite tell you which is more powerful. I really do think that both are really important. And we have found that with mothers who are 40 weeks, that most of them are going to go into labor within 48 hours after the massage. Of
Really?
course, we cannot guarantee anything, and there's no magic button, right? Nor should there be. But if your body's close to wanting to do this thing, but you're so stressed out and the clock is ticking and people are talking about interventions and C-sections and things that you don't want to do with, how is your body going to feel safe enough to get
Totally.
into, right? So I do think that massage is powerful in that sense, again, because we're spending a significant amount of time holding this container for you, right? The minimum is 60 minutes. We can do 90 minutes. And in that time frame, again, we're doing specific techniques that are soothing and sedating to the nervous system in conjunction with these induction points. And these are points that draw energy very strongly downwards in the body. They create an internal momentum towards later labor. Some of them, like in particular, help baby drop into the most ideal position. And it's really interesting too, because there are certain points that each individual baby will respond more to than others. And so sometimes after induction massages, I'll be like, okay, your baby seemed to like really like these points. So, and I've even like taken like little markers and marked the points for my clients. They can go home and like keep playing with them. But again, like I can't fully tell you which one is more powerful, if it's the induction points themselves or if it's just the safe space to connect with their breath and to get their nervous system to just fully exhale and to feel safe enough to do what the body wants to do.
Totally. And that's something I see a lot is, obviously we know it's such a surrender for the timing and the trust in the timing, but then you add that pressure. And
Yeah.
how can some people have a really hard time with that self-regulation, which is so, so vital throughout the birthing process. And
Yeah.
of course, beyond as you become a mother. But that is such an important thing. And I think anything that even encourages that is like time well spent because
Yeah.
you got to learn to regulate that. That's, I think, one thing I encourage my clients is throughout the entire pregnancy is just like, how can we kind of access that state of calm and zen that will pay off, because when you find yourself, you're like ready to meet your baby, you're over being pregnant, you might have these timelines and these constraints, and it starts to get stressful. And like you said, ain't nothing's going to happen if you're living in a state of high stress. It's just, why would anything
Well,
open?
it's not designed that way, right? Yeah. I mean, we know animals in the world, like they go off and they, hide. And if something feels scary or dangerous, like labor will shut down. It's designed to kind of wait for a space because it's like the peak level of vulnerability, right? So why is your body going to do something at peak? I mean, it's peak performance. It's absolutely miraculous, but it also entails a certain level of vulnerability. And so, yeah, it's not going to want to do that unless it feels safe enough. So I do think that massage is just a wonderful way to do that. And it doesn't have to be like right at your due date. You can start priming your nervous system earlier on and throughout the pregnancy to be able to almost like a roadmap, find your way back to the place that you can access in massage.
Yeah, absolutely.
Yeah.
I love what you mentioned that polarity too of like it's this, then it's also that. I mean, it's all embedded in there and they're all equally important.
Yeah.
Um, So we know the body keeps the score, and we know that trauma is, stored in us and not the body's not viewing this as like this happened 15 years ago, like we got to get over it. And so
Yeah.
you offer a bereavement massage, which I think is so beautiful. So I imagine it's for people that have had loss, of course, hence the word bereavement, but also
Yeah.
I imagine people come that maybe had traumatic births and they want to really change the course of their next birth. I know given your personal experiences with your births, with if people
Yeah.
have not listened to or heard your story, they definitely should. But I would love to talk a little bit more about that massage as well, because I think that's so, so important to kind of, I imagine just that somatic release and getting energy flowing. Is that kind of the gist of why you offer that massage and what's going on there?
Yeah, I mean, a bereaved mother is still, it's a postpartum mother. So we're doing a postpartum massage. Um, but the focus is a little less on the repetitive strain injuries of childcare. And it's a little bit more focused on the closing, which is also still part of our intention when we do postpartum work, drawing back to the midline after this huge expansion of birth. What just happened? Where is my body in space and time now? Where are the edges of my form, and drawing that energy back to the midline and giving a little bit of a closing. We do all of the same, or at least it's an option to do all of the same postpartum abdominal work, regardless of when the loss happened, if it was, a miscarriage in first trimester versus, a stillborn baby. We can hold that space because the body is still postpartum to some degree, regardless of the loss. And so, yeah, I mean, it's it's not a huge difference in terms of what our hands are doing and how the body receives the work. But I really wanted to name it so that clients knew that they belonged here, that they had a place here because I just kept seeing it throughout my practice of like, can I come? Is this okay? I feel called to do this thing, but I don't know if if I'm invited here. And I'm like, yes, you are invited. And yes, in terms of, the trauma that the body holds, um, you know, we're not we're not talk therapists, but we can hold space for your stories. And sometimes being able to tell your story while having this place, like your entire body moving the energy through and then having particular reverence for your abdomen, this place that held life, I think for certain people has been instrumental in helping them move through their grief because sometimes, the talk therapies, which again, like hold so much value, and some therapists are just so wonderful at that. That's not necessarily always what's going to help the body realize what has happened. And so something like the postpartum work and moving the energy through and drawing the energy and closing the energy up after that expansion can be really, really powerful for some of our clients.
Yeah, and I love that you named it that. So, like you said, people understand because that's a really good point. Like they are postpartum, but it's different and they still need love and care the same way they would, if not even more, and
Yeah.
kind of not understand where they fit in. But that's a really beautiful offering. And, you just have such a warm and nurturing disposition. So it's no surprise that that shows up in the space you've created and the offerings that
Oh,
you
thank
do,
you.
because that is really creating, a really comfortable space for people that of all walks of life that are going through all different stages. And
Yeah.
I'd love to finish with just you obviously being a birth worker, massage therapist, and having your own children. What are some top tips that you would give to soon to be mamas or even moms in postpartum? Just it could be anything birth related, massage therapy. I know that that's, I would just love to hear because you have so much experience and you see so much. So I'm sure you've got so many pearls of wisdom.
Thank you. Yeah, I mean, I feel like there's so many, directions I could go with that. I do think that nutrition is super important and making sure that you're eating enough and not underestimating, especially like protein requirements for pregnancy. I tend to see clients that are like more undernourished than they might think that they are. So I would just like make that a top priority. Lily Nichols is such a great resource for great recipes and understanding, like especially if you're like type A where you just want to know everything and you love learning. She backs everything up with evidence and so I love her. So yeah, I think nutrition is really important. But yeah, it's hard. For me, like I just feel like the journey in pregnancy is so nuanced that really seeing if you can from the very beginning trust your own intuition and see like really feel if things land and feel good for you. I can say I feel like one of the things that I can speak to that's pretty unique to my journey is like you mentioned um, just a moment ago, like my first birth was extremely traumatic. I had a totally unnecessary C-section that was preceded by like a very scary and inaccurate like HIV diagnosis, which turned out not to be true. It was just it derailed my entire plans. And yeah, and then I went on to have a beautiful sovereign birth at home with my second baby, and I was, my hands were the first hands to touch and discover him, and so I've had like yeah, two very different birth experiences, but I can tell you that like even having, the trauma from my first birth, thank God I had my team to really help me, move through a lot of that. Um, that there's still a lot of fear that can come up in pregnancy, whether you've had trauma or not. I just feel like fear can come up. And I feel like one of the things that I have learned is that you can make friends with the fear. You cannot like try and bid it, to leave you, but just know that it might be like somewhat of a companion and it doesn't actually have to impact your birth outcome at all. Like I had this beautiful birth for my second baby, but I was scared. I was scared going into it, even though I did a lot of work. I was scared, during labor, just I think because of my first experience and it still turned out exactly as I had hoped, and it was still really beautiful. And so I think that I just wanted to share that that if you are still working through your own fears, just have a lot of grace with yourself and know that fear doesn't have to be like completely extinguished for you to still decide that what is right for you, what is right for your baby, what is your vision for your ideal birth, can still come to fruition.
That's amazing. I mean, your experience of the two opposite ends of the spectrum is just so fascinating and so inspiring because, like you said, it is possible. Like I always say, we're the writer, the director, the actor,
Yeah.
the producer, we're the everything. And so
Yeah.
much of what we do just has to be like our trust in ourselves and the belief that we can.
Yeah.
And yeah, I know it's hard, especially if we haven't done something, or even worse, if we have done it and we didn't get the outcome that we desired.
Yeah.
Drawing on your past experiences, or you're drawing on anticipation of the what ifs.
Yeah.
And that's really hard to quiet sometimes, but then just like how can you find, your instinct and your intuition, which are your guiding lights. And you see that
Yeah.
at birth, right? Like the mom, she's just like, I know what position I need to be in. This doesn't feel good. This does feel good. This is what I need. Like before they get to that point, they're like, I don't know, I don't know. And then the minute they're in birth, it's like they got it. And we just have
Yeah.
to hold that space and create the container for them to do their thing. And like their instinct is spot on. Like that is absolutely true. So
Yeah, it's true. It's true. And I think that, I wasn't I wouldn't say that like fear was like, front and center in my and experience, but it also didn't go away. So I think I just wanted to speak to that. It was along for the ride, but you can still navigate that and create just a wonderful, experience that is in alignment with how you want your birth to go. And um I just love, the space that you hold, for clients and the lens of reverence that I think that this life, event really deserves. I just see how much intention you put into that, um, just that stems from you, but also like, holding that space for your clients, I think is so, so powerful. So I just wanted to thank you for that too, Kylie, because it's
thank you
really,
so
it's
much.
really important.
I appreciate that. And what you were saying with like the fear doesn't have to be fully extinguished to move forward. And
Mhm.
that's just, words that we could take with birth and everything, right? That's there's always going to be maybe a little bit of that with us, but it's just what we choose to do with that and,
Yeah.
call it in. So thank you so much. If you want to share maybe like obviously your offerings at Sparrows Us, people can check it on the website and your Instagram. Anything else that people can check out some of your work?
Yeah, I mean, I think the only thing that we didn't mention much of is that we also help people prepare for pregnancy. So we do a lot of fertility work with Mercier therapy, so a lot of, lifestyle guidance, but most especially with this Mercier therapy is a deep gynovisceral massage of the uterus and the ovaries and the entire pelvis itself. So all of the ligaments that attach to the pelvis, balancing the uterine position, bringing a huge amount of blood flow. And it's a 6 week program. So it's a massage once a week for 6 weeks. And yeah, we've just had a lot of success with clients either avoiding, the IVF route or using our services preemptively to make sure that they had the best outcome with
That's
the IVF
incredible.
route.
Oh,
Yeah.
I love that. Thank you so much for sharing that.
Yeah,
That's
my
incredible.
pleasure. Yeah, we love it, it's an entire spectrum, Sometimes you'll have a baby and then you might be struggling to get pregnant the second time, and so it, yeah, it's just an entire spectrum and we just really want to be there to support every facet of it.
And you're
So,
doing it, girl. Keep it up. We love it. Thank you so
thank you
very
so much for your time, Kylie. It was so great to be with you. Thank you
much.
for your thoughtful questions.
Of course. I'll see you soon.
See you soon.
Bye.